Hi everyone. Today we are going to talk about what to do if you or someone else suffers from burns. Burn injuries can happen due to heat, fire, hot liquids, or electricity. Severe burns can lead to serious complications if not managed properly. Knowing basic first aid and seeking timely medical care can help prevent complications. Step 1. Stop, drop, and roll. If clothes catch fire, do not run. Stop immediately. Drop to the ground and cover your face with your hands. Roll over repeatedly to put out the flames. Step 2. Cool the burn immediately. Cool the affected area under clean running water for at least 20 minutes. Do not apply ice directly on the burnt area. Remove any tight clothing, jewelry, or accessories near the burned area if they are not stuck to the skin. Seek medical help if they are stuck. Step 3. Protect the burn. Do not burst any blisters formed on the skin. Do not apply butter, egg, toothpaste, oil, or any home remedies on the burn. Cover the burn with a clean cloth or sterile dressing. Step 4. Manage pain and prevent infection. Avoid touching the burned area unnecessarily. Keep the affected area clean to reduce the risk of infection. Step 5. Seek medical care. Consult a doctor for proper evaluation and treatment. Seek immediate medical care for severe burns, large areas, or burns involving the face, hands, feet, or genitals. Important. Do not ignore even minor burns even on hands or face. Watch for signs of infection such as redness, swelling, pus, or fever. Do not delay seeking medical care. Use emergency services such as 108 or 112 if needed. Remember, prompt first aid and timely medical care can prevent complications and improve recovery. Stay safe and stay informed. Thank you.